Welcome to my channel, my all friend. Today our device is ventilator machine. A ventilator machine, also known as a mechanical ventilator or respirator, is a critical medical device used in hospitals and intensive care units, ICUs, to support patients with breathing difficulties or respiratory failure. It plays a crucial role in delivering oxygen and removing carbon dioxide from the lungs when a patient is unable to breathe effectively on their own. Ventilators are designed to assist or completely take over the breathing process, providing necessary respiratory support for patients in various clinical situations, such as 1. Number 1. Respiratory failure. Ventilators are commonly used to support patients with respiratory failure, which can occur due to conditions such as acute respiratory distress syndrome, ARDS, pneumonia, chronic obstructive pulmonary disease, COPD, or severe asthma. 2. Number 2. Anesthesia and surgery. During surgical procedures, patients may require temporary assistance with breathing as general anesthesia can cause respiratory depression or paralysis. 2. Ventilators ensure adequate oxygenation and ventilation throughout the surgical procedure. 3. Number 3. Critical care and ICU. Ventilators are essential in critical care settings and ICUs where patients with severe illnesses, trauma, or compromised respiratory function need advanced respiratory support and management. Key components and functioning. A ventilator machine consists of several key components. 1. Number 1. Control panel. The control panel allows healthcare providers to adjust and monitor various parameters, such as oxygen concentration, tidal volume, amount of air delivered per breath, respiratory rate, and positive and expiratory pressure, PEP. 2. Number 2. Breathing circuit. The breathing circuit connects the patient to the ventilator. 2. It comprises tubing, a ventilator circuit, humidifier, to add moisture to the inhaled air, and a patient interface, which can be an endotracheal tube, tracheostomy tube, or face mask, depending on the patient's condition. 3. Number 3. Sensors and alarms. Ventilators are equipped with sensors that monitor parameters such as airway pressure, volume delivered, and oxygen levels. 3. Alarms alert healthcare providers if any parameters deviate from the set range, ensuring patient safety. 4. Number 4. Modes of ventilation. Ventilators offer various modes of ventilation to cater to different patient needs. 4. These include volume-controlled ventilation, VCV, pressure-controlled ventilation, PCV, assist-control ventilation, ACV, and synchronized intermittent mandatory ventilation, SIMV, among others. Clinical management and monitoring. Managing patients on ventilators requires skilled healthcare professionals who monitor and adjust the settings based on the patient's condition. Regular assessments are performed to ensure proper oxygenation, ventilation, and avoidance of complications such as ventilator-associated pneumonia, VAP, or lung injury. Additionally, modern ventilators often come with advanced features such as lung protective strategies, lung recruitment maneuvers, and weaning protocols to optimize patient care and improve outcomes. Ventilator machines are vital life support devices that provide mechanical ventilation to patients with respiratory failure or compromised lung function. They assist in maintaining adequate oxygenation, ventilation, and respiratory support, allowing patients to recover while their lungs heal or function is supported. Proper utilization, monitoring, and management of ventilator settings are crucial to ensure patient safety and optimize outcomes. A ventilator machine, also known as a mechanical ventilator or respirator, is a medical device used to assist or replace the function of a patient's respiratory system. It is commonly used in hospitals and critical care settings to support patients who are unable to breathe adequately on their own. The basic principle behind a ventilator is to provide a controlled supply of breathable air, including oxygen if necessary, to the patient's lungs. The machine delivers air through a breathing tube that is inserted into the patient's airway, typically through the mouth or nose, invasive ventilation, or via a mask, non-invasive ventilation. Here's a simplified explanation of how a ventilator machine works. 1. Number 1. Oxygen source. The ventilator is connected to a supply of medical-grade oxygen, which may be from a central oxygen system in the hospital or from oxygen cylinders. 2. Number 2. Air intake. The machine draws in ambient air and mixes it with the oxygen supply, adjusting the oxygen concentration as required. 3. Breathing circuit. The mixed air and oxygen pass through a series of tubes and valves into a breathing circuit. 3. The breathing circuit includes an inspiratory limb and an expiratory limb. 4. Number 3. Sensors. The machine incorporates sensors to monitor the patient's respiratory parameters, such as the flow of air, pressure, and oxygen levels. 4. These sensors provide feedback to the ventilator, allowing it to adjust its settings accordingly. 5. Number 4. Ventilation modes. Ventilators offer different modes of ventilation based on the patient's needs. 5. Common modes include assist control, AC, synchronized intermittent mandatory ventilation, SIMV, pressure support ventilation, PSV, and others. 5. These modes determine the timing, volume, and pressure of the breaths delivered by the machine. 6. Number 5. Control panel. The ventilator is operated and programmed using a control panel. 6. Medical professionals set parameters such as tidal volume, the amount of air delivered with each breath, respiratory rate, and inspiratory/expiratory ratio based on the patient's condition and requirements. 7. Number 6. Alarms and safety features. Ventilators have built-in alarms and safety mechanisms to ensure patient safety. 7. Alarms can alert medical staff to issues such as high or low pressure, disconnection of the breathing circuit, or low oxygen levels. 7. Safety features help prevent excessive pressures that could damage the lungs. 8. Number 8. Patient monitoring. Ventilator machines continuously monitor the patient's vital signs, including oxygen saturation, heart rate, blood pressure, and carbon dioxide levels, using sensors and additional monitoring equipment. It's important to note that the operation and management of ventilators require specialized training and expertise. Medical professionals, such as doctors, respiratory therapists, or nurses, closely monitor patients on ventilators and make adjustments to the settings as needed to optimize respiratory support and patient outcomes. Hello everyone. I'm excited to announce that we have a fantastic video coming up next week. We'll be continuing our series on ventilator machine.